All right, so we have a special guest with us today. We have Amanda Bautista. She is a BSN RN, and she is a PhD candidate at the School of Nursing. Amanda, do you want to talk a little bit about yourself?
Yes, of course. So, hi everyone. It's a pleasure to be here with you all today to talk about a little bit about nursing, the pathways to get to nursing school, and after nursing school in grad school. So, my name is Ananda Batista. I'm from Brazil, in South America. I graduated in Brazil in the Federal University of Paraíba, and I came to the US in 2028 to do my PhD. So, what is the PhD? No one here knows what is a PhD degree. Anyone has any guess or idea about it? Anyone? Yes, it is a doctor's degree. That's right. What else? What are you guys thinking? So the PH, yeah, the big brain. I hope so. I like this. So the PhD in any areas and also in nurse is a doctoral degree where we do research. So in a PhD program, we learn how to do research. We learn the methodology of the research, the risks, and how to treat our participants, how to conduct, how to be the principal investigator of our research. So for example, today we have the COVID, and to do the vaccine of the COVID, we needed a PhD professional to conduct the research so we could get the vaccine. So the PhD, as someone said here in the chat, is the highest degree that anyone could get. So it is also the highest degree in a nursing career. We are going to see that later. So I am a PhD candidate. I am in my last years of the PhD where I will conduct my own research. My research is about pediatrics. So I work with youth with type 1 diabetes and autism. I'm also a teaching assistant at the College of Nursing for Pathophysiology and Pharmacology 1 and 2. So it is a pleasure to be here with you all, and let me know your questions and I'll be glad to answer that. So, yeah. So please next slide. So today we are going to talk about the pathways to a nursing career. So we are going to see how many ways that we can pursue to get the nursing degree and also the graduate degree after nursing school. Thank you. So I would like to begin with the types of nursing credentials. So the first one that I'm going to talking about is the Certified Nursing Assistant, that is known as CNA. So the Certified Nursing Assistant helps patients with direct healthcare needs, offered under the supervision of a nurse who is a BSN or N. The CNAs work directly with patient and nurses, helping with many physical and complex tasks for patients' care. And some of their responsibility, for example, include the turning or moving patients at the clinics and units. The licensed practical nurse, that is the LPN, they help patients in nurse homes and other healthcare facilities working under the direction of doctors and nurses. So nurses in this case, again, is who have the BSN and RN, the license. The LPNs check patients' vital signs, change dressings, and provide types of basic patient care that don't need like higher skills to do it. They also help patients with bath and dress when they need it. The associated degree in nursing, that is the ADN. So you can earn an associate degree and become a licensed RN with like in 2 years. You can gain essential work experience in the field sooner than others. You can start like building nursing connections and nursing relationships with patients, and in just like 2 years of study. That is different from the Bachelor of Nursing Science, that is the BSN. So the BSN is 4 years in college, and in most of the colleges, it is the 2 first years is the basics in health, like pathophysiology, pharmacology, anatomy, nurse leadership, for example, nurse history, basic for research. And the last 2 years, it's about our specifics that are about like pediatrics, women's health, med surge, mental health, and so on. So the difference between the Bachelor of Science in Nursing and the Associate Degree in Nursing, for example, is that the BSN, they bring with them the science. So the ADN, they don't have the science in their education. Only the BSN has it. So they have more knowledge about, for example, the physiological process, how to apply that in practice, and so on. So the Mastery Science in Nursing is the MSN, is a graduate program that we do after the BSN. So they will, you are going to be a specialist in a nursing area such as pediatrics or women's health, for example. The Doctorate of Nursing Practice, the DNP, it's a doctorate degree. So it's also a graduate program. So in this part, you are going to begin a doctor of the practice. So you need to choose an area of expertise, for example, pediatrics, that's my area. So this program, it's about 3 to 4 years. And I'm going to be a nurse practitioner in that specific area. And I'm going to work directed to the patients. I can prescribe medication, I can prescribe labs, for example. So we'll have a little bit of autonomy with this doctorate. So as I already said here, the highest degree that nursing can get is the PhD. So the PhD, it's above DNP. It's one, I heard that very much when I am like in school or when I'm talking to some colleagues from another areas in the university. They most of them think that the GNP is higher than the PhD, but that's not true. The PhD is the highest degree. And why? As I said, we do research. And when we do research, we create a knowledge. So here as a nurse, I do research in nursing to create a knowledge about nursing care inside of hospital, home care facilities, healthcare facilities. So I am doing research to create new knowledge to be applied in nursing care in the hospitals or primary care. And who does this implementation? So who does this implementation is the nursing practitioner, the DNP. So the DNP take our analogy, the PhD analogy, the knowledge that I will produce, I will create. They put this in practice. So the PhD is the foundation of any profession and in practice because we generate new knowledge, we generate science. So those are the programs that the nurse can pursue. So the CNA, LPN, ADN, and BSN, they are undergrad, and the MSN, DNP, and PhD, they are grad programs. Please, next slide. So post-high school nursing jobs. So you can get the certified nurse assistant. The educational requirements for that is the high school diploma or the GED. And the CA training certificate can be got in 3 to 12 weeks. So you can get your CNA certificate in a community college, for example. You don't need to go to the university for that. So it will be cheaper too. So many students prefer to go to this pathway first. Also, there is the license of practical nurse that the educational requirements, it's also the high school diploma or the GED, and it will be the LPN training diploma that it's about a year. Next slide, please. So for registered nursing, that is the RN, the pathways are, the pathway 1 is to earn an associate degree in nursing, that is the ADN, that is what happened like in the past years that we didn't have the BSN yet. So many nurse professionals, they had the ADN, for example, the associate degree in nursing. And so we created the BSN, and most of the hospital was requiring the BSN. So many of the ADN professionals, they already did 2 years. So they moved to the university to do more 2 years of the bachelor degree, so they could be the BSN. So many of them did this pathway. So here is, again, earn an associate degree in nursing, that is 2 years, and pass in the NCLEX exam, that is the exam board. So you can practice as a registered nurse. The pathway 2 is earn the BSN, that the bachelor's degree in nurse, that is 4 years. As I said, it is where you earn the science in nursing, that why it's 4 years. And after the 4 years, you do the NCLEX exam, and so you can be a registered nurse. And the pathway 3 is the Master of Science, the graduate entering program. It is when someone did their undergrad in other area of analogy, for example, I don't know, biology, journalists, whatever. And so they didn't like it, and they already had a bachelor. They don't want to go to undergrad level anymore. So they can do the Master of Science graduate entry program, that they will do the Master of Science in Nursing. That is 2 more years in the graduate program. So they can do the NCLEX and also be a registered nurse. So they can all like spend 4 more years in nursing college. They just do 2 years of master because they already have a bachelor degree in something else.
Awesome. Ananda, we have a quick question from Rosie. Rosie, do you want to ask your question?
I'm wondering, like after all these pathways, everyone just ends up being a registered nurse. That is what, you know, someone who wants to be in nursing, that's what they come out as after schooling.
Okay, one more time, Rosie. I don't know. I didn't hear you that well.
Yes, it was very like low.
I'm wondering about the first pathway. Is it you complete college in like 2 years, being an associate's degree, and that's it? Then you end up getting a job. And for the other 2, you end up going to the College of Nursing UIC provides, and then just do more years of schooling basically. And
Yes.
each of the pathways, they need to take the same test, and then afterwards they end up being registered nurses.
Yes. The difference is that the second pathway, it's 4 years because you do the bachelor's. So you do the same exam as you said, and you are going to be able to work as a registered nurse if you pass in the exam. That's right. However, the salary from a nurse who has the bachelor degree will be higher than a nurse who has only the associate degree in nurse, because the associate degree nurse doesn't bring the science, it's more the technique of the nursing science, the nursing profession. So the nurse who has the BSN, the salary will be higher than a nurse with the ADN only.
And just to add on to that a little bit more, so the
Yes.
ADN is an associate's degree, so that's 2 years, whereas the bachelor's degree is 4 years. So it's a little bit more specialty. You can get certain jobs as a BSN rather, or other, you can get more jobs as a BSN than you can as a ADN. So it opens more doors for you to, let's say you wanted to be a labor and delivery nurse. Um, those positions would be reserved more so toward BSNs because they have more education and can specialize in that, if that makes sense.
Yes.
Also,
So as
Donnie, Jesus made a comment in the chat as well.
yes.
Yes, some hospitals and clinics do not hire ADNs, unfortunately. And the more as time goes on, the field gets a little bit more competitive. So getting your ADN is a great way to start as nursing, but getting your BSN really puts
stay
you
on there.
Yeah, it really gets you, it makes you more competitive when applying to jobs in hospitals and clinics. And like Jesus is saying, hospitals and clinics are moving toward accepting, potential employees if they have their bachelor's or their master's in nursing.
Yes.
Okay, so so you get your ADN first, and then you go to your BSN.
So
Yes,
that
you
could.
can do that.
Sorry, Amanda. You can go ahead and answer the question.
No, you can go ahead too. No problem.
So Rosie, these are just two different paths that you can take. Obviously, you just have to consider the time. Finances might be an option, or something you might have to consider. But both are registered nurses. Both pathways will end in you being a nurse.
Yeah. Sometimes, as I said, people, because of the financial circumstances, people do first the ADN, and so they work, and after that they got the BSN. Many people do that because of the financial circumstances. So,
But okay, so since they're different, you can just go straight to wanting a bachelor's.
yes.
Mhm.
Okay.
You can even get your CNA and then go straight into a bachelor's of nursing program. You can even get, let's say you go through your undergraduate career and you get a bachelor's in, let's say, like, whatever it is. Say you got a bachelor's degree in English, right? You can go and apply to master's programs to get your master's program or your master's degree in nursing as well. There are some branch programs like that. So there are so many different paths and so many different ways. So even if you just decided to get your ADN, it'll be well worth it, and there's always room to move up and get more education and become more specialized. Do we have any more questions?
With going straight to bachelor's, that's just gonna take less time, right? Than getting an ADN and then saying, "Oh, I want to get bachelor's now." Besides just one bachelor's, and then that's it.
Okay, so if I heard your question, going into your bachelor's, your BSN would, I didn't hear
I'm
that last
saying
one.
for an ADN, you say, okay, I'm an ADN, but I want to go to bachelor's. I'm just thinking that may take more time other than saying,
Yes,
I want my bachelor's and then that's it.
yes,
Okay.
So
exactly.
let's say like you're committed on being a labor and delivery nurse or a pediatric nurse, or let's say like a neurology nurse, you know. Going through a BSM program might be a better option for you if you want to, you know, specialize a little bit more. Awesome. So if we don't have any questions, I think we can keep going.
Yeah. So here we are talking about the advanced nursing degrees. So they are graduate programs that are after the BSN. So first we have the Master of Science in Nursing, that is the MSN. Moving from the BSN to the MSN program. It's a common pathway for nurses who want to pursue advanced roles such as specialized clinical practice, administration, and education. So as I said before, after the BSN, most nursing do the MSN to be specialized in some area of practice, administration, or education. Education can be universities to be professors, for example. So also, we have the Doctorate of Nursing Practice, that is the DNP. So nurses obtain the DNP to gain advanced practice knowledge regarding to patient care and evidence-based research and teaching. So what is the evidence-based research and teaching? So it was what I talked before. So the PhD will generate the knowledge, and so the DNP will take this analogy and translate into practice. So I am doing the DNP, we do nursing care based on research evidence, based on what science tells that is the best choice for that area. For example, pediatrics area, women's health area, and so on. So for example, the PhD is a Doctor of Philosophy in Nursing, that is my program. So this is the highest degree that a nursing can get. It's heavily research focused and it usually pursued by nurses interested in scientific and scholarly work. So for example, I can graduate in my PhD and I can work in hospitals. Hospitals can contract me to generate new knowledge. So for example, the hospital wants to get better in nursing care in pediatrics area. So they have a methodology that is not so good and they want me to do a research so I can find what is the best way to deliver nursing care in the area. So I do that research. I find that the best way to do the care in that hospital is using, I don't know, the methodology A, but it's better than methodology B to deliver nursing care. So the DNP will get the method A of nursing care and will implement in the hospital, for example. Also, the PhD can teach in universities. So they can be a professor too. In the same time that they can also be a research at the university. So they can be both at the same time and they are working in the university. So the Doctor of Philosophy is the highest degree. So here in the US, you can have two pathways. So you can graduate from your BSN, go straight to your DNP, or straight to the PhD without the MSN. That's okay. It was what I did. So I graduated from my BSN and I went straightforward to the PhD. I didn't have a master's. So this is one pathway. The second pathway is do the master's. So I do my BSN, and so I do my master's, and so I choose to do the DNP, or I do my master's and I choose to do the PhD because I like research more than clinical practice, for example. So there are these two pathways. BSN is straightforward to DNP or PhD, or after BSN, do the master's degree and so go to the DNP, or do the master's degree and go to the PhD program.
Do we have any questions on those pathways that Ananda just talked about? It can be a little bit confusing, so let us know if
Yes.
you have any questions. And just to reiterate, you do not have to go through every single step in the chain. These are just different levels of nursing careers that you could take. And if I'm not mistaken, Ananda, I think when you get your MSN, are you considered an advanced practicing nurse, right?
Yes. Mm-hmm.
Awesome. So yeah, so you could do a little bit more with your degree. You can be a nurse anesthetist, subacute nurse, or even a midwife, or deliver babies.
Yeah.
All right, so we do have two. Go ahead, Ananda.
Okay, go ahead. No problem.
We do have two options for you guys at the local community college, Malcolm X. If you guys are interested in, if you're not going straight into a 4-year university, you might want to get your feet wet first, get a certification. Whatever the nature is, Malcolm X is a really, really, really good school to go to. We recommend it to all of our high school students. They have so many different programs, from medical billing to CNA to phlebotomy to massage therapy to there's so many certifications that take less than a year to kind of, if you're looking to get your feet wet and kind of get a job. And even if you wanted to get a job while you go to, let's say, like nursing school, or while you're getting your bachelor's degree, these are really good options to consider. So the first is the Associates in Nursing, the ADN, at Malcolm X, and then Practical Nursing Advanced Certificate. So this is getting your LPN. So if you guys are interested, go ahead. The QR codes are right there. Let us know if you have any questions, and we can connect you to more resources.
Also, Ananda and Donnie, we have a question in the chat. Is there a website to just explore the careers in nursing? I don't know specifically what I want to do. Are there any websites or resources that anyone here could recommend?
So at the UIC website, they have all the options in the description of each of them, so you could explore there. Without being like a university website, I don't remember for the top of my head one of website that you can go through and learn about it a little bit more. So yeah, I recommend the UIC website. They will have all those pathways, and you can explore a little bit.
Yeah, and we'll talk a little bit more about different specialties. Obviously, you could specialize in, let's say, like age groups, so like pediatrics, geriatrics. You can specialize in certain let's say, like organ systems. So like you can be a cardiac nurse, GI tract nurse. You could, one of these specialties interests you. you could definitely, there's definitely positions that you can go and apply for. You know, if you have a specific interest in one of these fields. We'll also talk about more interesting specialties later on.
And just real quick, explorehealthcareers.org. That is a website that many of us have used to learn more about different health professions. So definitely check out that website, whether you're thinking about nursing, medicine, pharmacy, dentistry, et cetera, look at that website, and they have really helpful high school to health profession school pathway information.
Yes. And one of the things that I love about nursing is that, let's say you do get your BSN, you can jump around from specialty to specialty to clinic to different types of practices. So you're really it's, this degree is very powerful when you go into any sort of you know, field. So at the College of Nursing, they do offer 3 types of nursing programs. So the first is usually the traditional one that most people out of high school go into. So this is the Bachelor's of Nursing. This is the BSN pathway. You would essentially do your first 2 years of you know, gen ed courses, and then you would apply separately to the College of Nursing, and then you would get your BSN. And then do you want to talk about the other 2?
So the Master of Science in Nursing. So in this case, you must have a nursing background. So the requirements are a bachelor degree in nursing from a CCNA or SCEN, accredited program, or a bachelor degree in another field, and have a graduate from a nursing program. So those are the Master of Science in Nursing. And the last one is the Master of Science Graduate Entry Program that are for individuals that they don't have the nursing background. So as I said, they have like a bachelor degree in journalism, English, biology, and so they don't have a bachelor degree in nursing related field, but they want to be a nurse. However, they don't want to do 4 years of the Bachelor of Science in Nurse because they already have a bachelor degree. So they go to the Master Graduate Entry Program. So for individuals without previous nursing preparation who hold a bachelor degree in field other than nursing. So the requirements are, so they must have the bachelor degree in any field. It's not like be related to nurses, can be any other degree, as I said, like English, literature, biology, I don't know, marketing, and I don't know, any of them. So they can do the master entering program. They have to have a GPA 3 to 4 and 60 semester hours of the first bachelor degree. And GRE is required if the GPA is less than 3.25. So GRE is exam for any graduate program. If you want to do any graduate program, those programs will require you to do the GRE. So here at UIC, you only need to do the GRE, that is this exam to graduate programs, if your GPA in your last bachelor degree is less than 3.225.
We have a
Um,
question in the chat. Daisy
yeah.
asks, when do you recommend to start taking internships during college? So Daisy, are you
So,
referring to general internships or if you're thinking about pursuing a nursing? So perhaps Ananda, you can answer like nursing specific and then the rest of the coordinators. Nursing. Okay, so nursing specific.
oh, so for example, as you said at UIC, we have the pre-nursing, that is the first 2 years. And so you do the nursing program that the last 2 years of the bachelor's degree. So I recommend to looking for nursing internships at like your first year of in the nursing program. So at UIC would be your junior's year. So for example, I had many students that they did the pre-nursing, that is the first 2 years. And so this past year was their first year in the nursing program at UIC. So they already looked for internships for summer. So it was their junior year. So they began to see classes specific to nursing care, such as med surg, pediatrics, women's health, mental health. So when you begin to see class specific for nurse, like those that I said before, it's the time to looking for internships. Early as possible, you begin, best for you because you have more experiences that will help you in college and also to get a job in the future, and also to let you know what is the area that you like the most. Because many students that don't take internships during the summer or work in the hospitals like during academic year, they have some difficulty to choose what area they wanted to pursue after graduation. So the internships as early as possible will help you to decide what area of nursing care like pediatrics, women's health, mental health do you want to work at. So just when you begin to have class, a specific class for nursing school, for nursing care, begin to look for internships. Yeah, so that's right. Oh, Dennis, that's so many professors, they also take students from the first year to help them in research. So if you wanted to, I always said to my students, take all the opportunities that you can get in nursing school. So if you have opportunity to have an internship at a hospital, go for it. If you have chance to be assistant in a research for a professor, go for it. Because during nursing school, it's the time to gain knowledge about nursing care, of course, but also it's the time to explore the areas that nurses can act in clinical, in hospital, home care facilities, and research. So if you are interested about research, you can ask a professor to be their assistant, and professor take students from the first year to be their assistant. So just go and take advantage of those opportunities, because when you go out of college, you have like a lot of experience in like many areas of nurses. So it was what I did when I was an undergrad, and I don't regret about it. So
So we just want to highlight the 6 campuses that UIC has across the northern and central Illinois areas. So there's Chicago, Peoria, the Quad Cities, Rockford, Springfield, and Urbana. And then we also wanted to highlight the COVID-19 efforts that the UIC nursing faculty, students, and alumni are doing currently since the rollout of the vaccines. So as you can see, these are taken from different news stories that come from the UIC stories page. And they were just sharing about the efforts that UIC nursing students have done, whether that be on Springfield campus, Urbana, or UIC campus. So all the sister schools are working together to roll out vaccines to people. So as you can see, they vaccinated almost like 12,000 people. They worked with the homeless population with Unsheltered Chicago Coalition, and then also targeting the population over the age of 65.
So now we are going talking about a little bit of nursing careers and specialties. The first one is cardiovascular operating room nurse. So those are nurses that are specialized in cardiovascular care related to surgery, for example. How to take care of those patients that have cardiovascular disease and need surgery. So they take care like pre-operation, during the operation, and post-operation. Infection control nurse. So infection control nurse, they are very important always, but right now they are like most important than ever. So they control the disease that can be transmitted. So now, for example, during COVID pandemic, those nurses are very important at the hospitals because they will implement some interventions that can decrease the transmit like the COVID from one patient to another, or from like the patient to the healthcare providers, and so for another patients. Neuroscience nurses are nurses that study the neural system. And emergency room nurses are that nurses that work at the ER room. So they are the endorphin nurses, we said, because they are always at the call. They are always like with the energy like very high, because they are always like receiving patients, and each patient has a different cause of the disease, and they are recognized by the thinking, the clinical thinking very quickly, because emergency room nurses, they need to pay attention like in many things at the same time. They need to think about one patient very quickly so they can act and save the patient's life. The perinatal nurses, so are nurses that are specialized in, for example, mom and baby health, or just the baby health. And psychiatric nurses are nurses that work in a mental health area. So next, please. So the school nurses are nurses that working on schools, primary healthcare providers. The flight nurses are registered nurses who work for air ambulance in medical transport services. So they provide health monitoring and emergency care while patients are in transit to one medical facility to another, for example. The health policy nursings, they play an active role in forming, developing, and communicated public health policies with the goal of improving the overall and well-being of the society. The medical script nurses is very interesting one, because they act as a consult to the TV and TV shows and film writers, and even like book authors, to help them to ensure that the accuracy of the plots featuring the medical or nurse related plots and characters. So for example, Grey's Anatomy, they must have one medical script nurses, because they have to be sure that all the scenes are congruent with the health science. It's not like anything wrong. And the military nursing are nurses that work in the military. It can be in the Army or Air Force or Navy. The public health nursing, so The public health nursing is to promote health and prevent disease for entry in the population groups. So public health nursing work with other providers of care to plan, develop, and support systems and programs in the community to prevent problems and provide access to care. And travel nurses, they are nurses that have various clinical backgrounds who work for independent staffing agencies. So they are assigned to different care areas on temporary basis to fill in short-term employment gaps. So for example, there are nursing travel agencies. So I apply for those agencies and I'm open to work whatever like state and city in the US needs me. So if a hospital in California needs a pediatric nurse in that hospital for 6 months, they can send me to there and I will work there for 6 months. After that, if they need me in Florida, I can go to Florida and stay in Florida for whatever time they wanted me to stay there. So those are travel nurses and they have a very good salary to do that. Any questions?
So I know in the chat, we're having a lot of conversations about different nursing pathways, like fun job opportunities. We had some questions around scheduling. Donnie, do you want to recap the scheduling conversation that you were having in the chat?
Yes, so it's a really good question. Specifically at UIC, you will do, I feel like I mentioned earlier, you will do your first 2 years fulfilling the prereqs. So to get into the school, the UIC School of Nursing, you have to take, a certain amount of classes. You have to make sure that your GPA is at a certain level. You have to, so what I recommend is making sure that you have those requirements on lock your first year. Make sure your GPA is good, that you're fulfilling all those requirements, that you're on track to fulfill those. And also because college is a little bit of a different atmosphere in terms of academics, making sure that you are very comfortable with the process because it can be new and challenging at times. And then by your second year, once you have a good flow, then you can focus on getting internships, doing volunteer work, research if that's of interest to you. I would definitely recommend getting into maybe volunteering in like the pediatric department, or if you're in whatever specialty you want to go to or whatever interests you have, make sure you express those interests in your involvement. I think that's very important when you're applying to nursing school. And yes, volunteer at UI Health. We are in almost every single department. We also volunteer with nurse administration. So I could put you in with those that will potentially admit you to nursing school. That's crazy, isn't it? Volunteer. So Daisy said, how many classes do you recommend a nursing takes every year? So that's a good question. So as an undergraduate, it's recommended to not take more, or 12 credits are usually full-time. It's usually not recommended to take more than 16 per semester. I think the most I took was like 20 because that was crazy.
Yes, it is very busy. We have a lot of assignments. It is a lot of content. So don't do that with yourselves. You have to get life, besides nursing school. So, just don't take too much credit. Take the credit that you can support and give your best.